Disease relapse remains, unfortunately, the major cause of treatment failure in adults with acute myeloid leukemia. This is particularly true in older adults, probably because of increased frequency of adverse disease biology. And therefore, mindful of the fact that allogeneic transplant delivers the most effective anti-leukemic payload that we know of in the management of AML, it's really timely to think, how can we deploy such an effective anti-leukemic therapy safely in older patients? And the advent of reduced intensity regimens has allowed us to contemplate with some degree of equanimity transplanting patients in their 60s. And really until about 10 years ago, that was what we felt to be quite adventurous. But the age of transplant has steadily risen, and many of the patients who come through a routine transplant ward now will have been over the age of 60. But in the last 10 years, groups have recognized that the most important consideration is not chronology, but biology. And if a patient is fit, there's now abundant evidence that you can safely take such patients up to the age almost of 75, or in some centers up to 80, safely into a transplant. And this is really important because the only alternative therapy for such patients is either intensive chemotherapy, which delivers long-term survival rates of about 15 or 20% in that age population, or venetoclax and azacitidine, which is not curative. So the real question is not which patients should proceed to transplant, but which patients should not. And the default, I think, in newly diagnosed fit adults with AML over the age of 70 should be considered taking to them transplant. They should be tissue typed at diagnosis and unrelated search started. The patients who you wouldn't want to think of taking to transplant are patients with refractory disease, probably, or patients with such significant comorbidities that you can predict a high transplant-related mortality. So the recent CIBMTR data shows a steady increase in transplant activity in this population, which I predict will simply pick up pace.